Hello everyone, I am Dr. Vijay Rao, consultant rheumatologist at Divisha Arthritis and Medical Center, Bengaluru. Today I will enlighten you about lupus. Lupus in Latin means wolf bite. So this disease suddenly causes an autoimmune phenomenon where your own immunity system attacks your body, causing skin rashes, mouth ulcers, joint pains, excessive hair loss, weight loss, fever, accumulation of fluid around the lungs and heart. In extreme cases, it can affect the brain, causing lack of blood supply in the brain or seizures, extreme headache, or affect the kidney where the protein is not filtered or there's blood in the urine and there's excessive protein leak in the urine causing swelling of the body. So as you just heard me, it's not just about joints. So a rheumatologist is one who treats the immune system head to toe. That is, after general medicine training, we deal with immune system disorders which can affect any gender or any age. But lupus in particular is 9 times more common in female than male, and usually it affects between the age group of 20 to 40 years. So lupus, I always tell my patients, is like a fire. For a fire, you need wood, which is genes of the patient. You need kerosene, which is the female hormones, and you need matchstick, which is the sunlight. So when all these three, that is when a woman attains puberty, when becomes pregnant or delivers, or during postmenopausal, the hormone fluctuations causing estrogen fluctuation can ignite this fire in a genetically predisposed patient. Genetics, I mean that not everybody in the family should have. Some people might have, some people may not have. So, but it's the genes which actually triggers this immune system dysfunction and primed by the hormone fluctuation and ignited by the UV rays. Hence, we often tell patients to protect themselves with the sunscreen lotion with factor 50 creams. It is diagnosed by a test called anti-nuclear antibody or ANA test, which has to be done in the right way, requested by a rheumatologist. And when that is strongly positive, the lupus is diagnosed. There are further tests which check protein in the urine, which checks a test called C3 level. We check for heart, chest x-ray, so on and so forth. But if detected early, 80% live normal life beyond 10 years. So you don't have to worry that even though the disease is lifelong, if treated early by a rheumatologist who knows which organ can be affected by which symptom, which test to do, and which tablets to give. Like not all tablets are suitable for all manifestations or symptoms of lupus. So this is only a rheumatologist who can make this out. You can lead a normal life with early treatment, and slowly rheumatologist beyond 2 years of time slowly reduces the treatment to a bare minimum. Certain precautions have to be taken, especially during pregnancy. Sudden stoppage of tablets should not be done where lupus is usually high. Post-delivery lupus is usually high. We also check for a rare associated condition called APLA or APS, antiphospholipid antibody syndrome, which has about 50% existence with lupus. So, in effect, get yourself checked if you have any of these sun-induced skin rashes, early morning joint pains, severe hair loss, weight loss, lack of appetite with a rheumatologist. Get the ANA tested and get on the treatment and achieve and conquer the disease. Thank you very much and best wishes.